Bristol Budget Committee at 6 o'clock on Tuesday, November 18th. Surprise. We have a quorum, so we're all set to go. We'll start with the pledge. Vice, can you lead us today? Tonight?
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So I think we all have an agenda just for the public. This is the first of our 5 meetings where we're going to go through sections of the budget. We're going to do the 3 sections for the, what I call the non-municipal agencies. I don't know if that's correct or not. So, I don't think there's anything we need to do before we can get into new business. So our first section to consider tonight is 4197, which is advertising and regional associations. I'll go ahead and make a motion to advance or to consider section 4197, which is advertising regional associations in the select board recommended amount of $7,908.
Second.
Seconded by Joe.
Yeah.
Discussion? Does anyone have any comments? Or I think the only thing that I can think to say is that in past years, some of these numbers have at this point have only been estimates and can still, so is that correct, Christina? We're still waiting for NHMA and Lakes Region to give us a firm number, or are these what's our status?
It looks, sorry. No, NHMA, we did get a firm number. It just came in, and it's more money. It's,
So we have a firm number, but it's not the one in the document in front of us.
correct. When I estimated the 3%, it's gone up a little bit more. It's $3,965. But let me just check because I may have Lakes Region Planning. Yeah, so Lakes Region Planning came in higher too.
Okay, so if we approve the budget the way it is now, the town will not have enough money to pay these 2 membership fees. Is that a correct statement?
Correct.
You want to feed me those numbers again and we can make a motion to amend?
That's up to you. I can feed you those numbers again. I just,
Why don't you, we'll do them one at a time, so,
well, I was just trying to open Lakes Region Planning again.
okay.
So Lakes Region Planning, that line 831, we put in a 7%, but it's $4,144.
See, I did.
Yeah, right.
I don't have a piece of paper and a pen in front of me.
You want,
You want to go ahead and make a motion for that? So,
are we doing them individually as a whole?
I think we do them individually. We do a motion for a line at a time. I don't think we've ever, I don't remember ever doing a motion for multiple lines at one time.
Yep. Lakes Region Planning. So on a,
I'll make a motion.
Thank you.
That the
Go ahead, thank you.
line 4197-831 be increased from the amount of $4,031 to $4,144, which is the amount, the actual amount requested by the Planning Commission.
Second.
Okay, so we have a motion from Buzz, seconded by Scott, to increase the Lakes Regional Planning Commission, which is line 831, to a new number. What was the new number again, Buzz?
4144.
Okay. Any comments, questions? I don't think we haven't had any debate, so I don't think I need a motion to close debate. Let's just go ahead and do a vote. All in favor of the motion to increase the number from $4,031 to $4,144? Signify by raising your hand and saying aye.
Aye.
I got 7, so nays and abstentions are 0. That passes 7-0. What's the new number for NHMA?
For NH,
3965.
yep, thank you.
I would make a motion to increase line 4197-832 to 4,000.
No,
No, sorry,
to 3,000.
$3,965.
Seconded.
Okay, motion by Les, seconded by Joe, to increase the New Hampshire Municipal Association line 832 from the current $3,877 to a new amount of $3,965. Any comments, questions? Not seeing any, we'll go ahead and have a vote. All in favor? Aye. Les, you were an aye, right?
I said aye, yes.
Yeah, okay. So that's 7 abstentions and noes or none, that passes 7-0.
The new number would be $8,109.
Okay. So before we go back and vote on the total amount for this section 4197, are there any other comments, questions, motions to amend? Not hearing any? I'll call a vote now for approving the section 4197 for advertising in regional associations in the amended amount of $8,109. All in favor? Aye. Opposed? Abstained? That passes 7-0. This is good pace, folks. We're gonna be out of here soon. All right. What's that?
You can always keep going.
Can't hurt to keep trying, right? So our next, whoops, what did I just do?
This thing is not.
Our next section is gonna be healthcare, I think. Section 4415, health agencies. So I'll make a motion to open consideration of section 4415, health agencies and hospitals, in the select board recommended amount of $33,394.
Second.
Motion by Paul, seconded by Scott.
Wait,
Did I get
yeah,
open?
that was, the select board's amount was 25,000,
No,
No.
isn't
No,
it?
the bottom line.
No, 30, it's 25 for any,
Oh, for the total?
for the total
Oh,
is
okay, sorry, I
33,000.
thought you were doing individual.
No. So, we have a motion on the table for the section for healthcare and hospitals. And I guess I'll just open it up. Anyone have any comments, suggestions, questions, suggestions for changes?
Just a question.
Go ahead.
Apparently the select board decided to level fund it
Correct.
based upon the higher request from the agency. Is that the whole thought process?
So the actual is 16,700 for 2024. We level funded it right across 2025. There is a need, and there are a tremendous amount of services provided to this community from that agency, and most of the agencies that present in that matter,
So,
Can I add, Paul?
go ahead.
I just want to add that the board doesn't get to meet with the nonprofits and agencies, so they felt that the decision was better suited to come from this group because you were able to meet with the nonprofits and agencies where they aren't. So they level funded them, so.
And I gave them some input on that, but
Okay. And I'll point out, just to be completely transparent, the Lakes Region Visiting Nurse Association is level funded. This year, we have in the budget $8,050 for pending Baker, and they requested $8,044, so they're actually $6 less because we have in there what they asked for. Not sure why that is there. So this is something that, I'll take the opportunity, as you're new to the committee, this is something we spent time on in past years. That when I started over 5 years ago, Lakes Region Visiting Nurse, which is the successor to Nana, was getting $33,000. And certainly during COVID, when you couldn't assemble the services, the services that they were able to provide reduced. So we decided to reduce their funding. And they've consistently asked us to go back. We went up last year from the $16,700 in 2024 to the $25,350 in 2025. The select board's proposed to level fund them, but I think, as Christina said, they didn't spend a lot of time on this because we had all those agencies come in a month ago and give us I don't know, I personally will share that I'm always very conflicted with this. I think that these people provide services to the town and are valuable members of the community. I struggle with the idea that we use the power of taxation to force all of our residents to make contributions. I'm not real fond of that, but don't want to recommend zero funding because I don't want to cause these people horrible problems. If I had my way, I'd wean them down to eventually get to zero, but in past years when I've proposed that, the majority of the board has not agreed with me, so I've kind of stopped that crusade.
Based upon their presentation, they did highlight with the folks that are up in here in Bristol area too.
Yeah.
So, having been around so long that you can quote history.
Oh, you got way more, go ahead.
Did you have your hand up first?
No, go ahead.
So, we had always, for as many years as I can remember, down to 32,400, we had gotten it up to that. And then, when they were no longer NANA, there was a movement to reduce it, feeling like it wasn't a community organization. And because of the presentation by whoever was in charge at that time, we reduced the amount, as I recall. And then Walter Waring made a passionate request for us to increase it again, based on the fact that they were providing more services and doing more. My concern when I heard that they were selling the building was that was going to mean they took a really big hit with this, whether we could support them still. But from their presentation here, it sounds like they're still going to be providing the services that they have been. So originally, I would have thought perhaps this year we'd be looking at going back to the 33.4, but I'm comfortable with staying with the 25,350.
Yeah, you bring up a point. I mentioned the fact that, before COVID, they had blood pressure clinics and foot health clinics and things they could do, and during COVID, they had to stop doing those because you couldn't assemble people. I had forgotten, and Les brought up, they've also gone through quite a bit of turnover with their executive director, and the people that we saw at this point have been there just a little over a year. But they had the person who was here 4 years ago made a very strong impression, not in a good way. And then the person who was here 3 years ago seemed better, but they had problems with him, so they moved on. I think that they provide a valuable service to the community. To me, their fundamental business is to provide home health care, which is primarily reimbursed through the federal government, and that right now is not in a really good place. But the amount of money needed to fix that is way more than what Bristol would be able to or willing to provide. So I think sticking with the 25 is probably what I'm most comfortable with, but I'll stop talking and see if anyone else has any other motions or suggestions.
I think I would most often likely be the one to propose going back to the original amount, but I'm comfortable with the 25,000. I think, I know there's a lot of folks in our community who are hurting in a really bad way right now, so I'm comfortable staying flat on this.
Mhm. Yeah, me too. I'm not in any way want to raise it
All right.
at this point in time, nope.
No? And I will share, I made this suggestion last year, so I'm sharing it again mostly for Brian's benefit, but I had actually said that for me, I would be willing to support raising Lakes Region at the expense of taking away from Pemmy Baker. And that had no support from the committee, so we didn't spend much time talking about that.
We could raise it to $356.
Yeah, but Penny Acres aren't as many people, almost, as Lakes Region, so their service has increased quite a bit. And they didn't ask for any increase, whereas, you know, it's like they're relying on this from Lakes Region, and I'm not so sure that's a great thing to be, for any company. I asked them to send the paperwork on this to break down their prices, which would, you know, kind of figure out why and that's the correspondence that you have. I know you want to go through the correspondence after, but this is pertinent to what we
Go ahead, bring it up if you,
basically.
and you had asked for it. so
I had
that's-
asked
go
for it,
ahead,
exactly,
go ahead.
so which kind of has a breakdown of what their revenue is and what, they have to like pay out of pocket type stuff. So basically, to me, that's helpful, but, you know, to me, the top line, and they do provide a great service. So I get that, you know, and everything, and it is our duty to help them out a bit, but it's not our duty to take over for any of their shortcomings, as far as I'm concerned. They're a company to begin with. They're, you know, so I'm comfortable with the 25. I didn't actually want to go up last year, but I'm comfortable with the 25, but I would not be comfortable with the 33. But if you didn't read this, this is a breakdown of their stuff from Lakes Region and the mental health, Lakes Region mental health as well. They were nice enough to send something. So I don't know if you had a chance to look at it.
All right, so I don't want to cut people off. If somebody else has a question, a comment, or a motion to amend, I'm open to that, but not hearing that. I think at this point, we can go ahead and vote on this section as is unamended, 4415. Speak up now if you, okay. So we're gonna vote now on approving section 4415 in the original amount of $33,394. All in favor, say aye.
Aye.
Thank you. Opposed and abstains, 7-0, that passes. All right. And now, we go to the bigger one, which is outside agencies, 4652. So I'll make a motion to open consideration of section 4652, outside agencies, in the select board recommended amount of $39,098.
Second.
Motion by Paul, seconded by Scott for section 4652. Yeah. So this one has a lot of lines in it. I expect we'll probably spend a little more talking about this. I don't have any motions to amend at this point. Does anyone else want to bring up a specific line or ask a general question or make a motion to amend?
For Voices Against Violence, I'm not sure I fully understand them over here.
Okay, what don't you,
So there were two amounts provided by the vendor?
Yeah, and we put the 10,256 in. We mentioned it at the public hearing,
Okay.
and they didn't ask us to change it, so I'm
Okay.
assuming that's let me just rephrase, I'm not assuming, but that's the number we put in,
Okay.
was the one that was on the cover letter.
So is that,
Here.
does that answer your question? I'm not sure what your question was, so did you get an
Yeah,
answer?
it was just the note mentioned that there were two different amounts, and we put the lesser amount in, and really my question was just, is that the right amount that the agency was requesting or not?
It came up in the meeting when they were here, and they were if I remember correctly, they were a little surprised there were two numbers and said they weren't significantly different, and yes, that was fine.
Okay.
Did anyone else remember or have any different? Okay.
The only other comment I'll add, and I don't know if Transport Central, I haven't had a chance to watch the video from that meeting, but I do know that they had a portion of their funding cut. And very, very important service for community members to make it to appointments. So non-urgent medical transports is a big part of what they do. So I just mentioned that I see that they requested 3,000, it looks like, we have them funded at 2,000.
Right. Yeah, Transport Central asked for more money, and Select Board level funded, recommended level funding. Voices Against Violence asked for a big increase last year, which we agreed to,
Yep.
and now they've asked for even a further increase, and the Select Board voted to level fund them. And,
Can I
go
just
ahead, yep,
ask Scott, with the select board level funding all these, is that again deferring to us because they weren't at the,
Mike, well, Scott can answer that.
Yeah, exactly.
okay, so.
I am double checking on the last line that says the $500. We think that there may be a way for us to take this out of the budget. We go back to the way we used to do it, and we're checking with NHMA now. So if I can, I'll bring that back to you.
You're talking about line 838 with the community garden?
Yes.
Okay. Just to finish what I was talking, I just wanted to mention, there is a third line in here. CASA it has $500 in this year's budget. They asked for $750, and the Select Board actually didn't level fund them. They left $750 in there. So those are the three lines that I see, and then Christina brought up the last one, which,
And Lakes Region Mental Health was level funded, sorry. I just wanted to point that out before you went on. They asked for.
oh, they asked for more
Yeah.
too, I missed that, thank you. So there's four lines where they asked for more money: Transport Central, Voices Against Violence, Lakes Region Mental Health, and CASA.
They may have missed CASA when they,
Okay, and then this last one, the note here says that it's a new line in the budget, and it has to do with more of an accounting thing than a funding issue. That if whether we approve it or not, if it happens, it's grant funded, so it's not tax funded.
correct, correct.
Well, I don't have any motions to amend. Does anyone else have any questions or suggestions to change anything?
I don't know if anybody had a chance to look at Lakes Region Mental Health, their breakdown of their amounts, which would justify, at least to them, that they would like the increase due to all of these increases that they've had to deal with. So I don't sure if this is something that anybody or everybody has read that was sent with the paperwork.
Well, I will admit I glanced at it, but I didn't read it in detail.
Well, Lakes, I just think that I'd like to make a motion to give them the amount that they're asking for, which is the $8,716, as opposed to the $7,000.
I'll second it.
That's what I was gonna ask for. Okay, so we have a motion by Sue, seconded by Joe, to amend line 675 from the current value of $7,000 to a new value of $8,716. Since it's your motion, Sue, you get to talk first.
I just, to me, one of the number one issues, not just here in Bristol, in the country, is mental health issues. I just think that it's a really rising battle that they have to fight in order to get, some of these issues resolved with people. And I just think that they need a little bit more assistance. It's increased in this, in our own town, and if they don't get a hold of it, it's could cause greater issues. It's part of the reason when they talk about the violence in the country is not necessarily, it's mostly, I should say, mental health issues. I mean, there are people who have these issues that have never been seen, talked to, or whatever, and where it is increasing, I just think the need arises for them to ask for more money, and I would agree to give that to them. That's my opinion.
I'll wait and see. Yeah, go ahead.
I would just say, I agree with the motion simply from the perspective that services like Lake Street Mental Health are about to be in a position where a significant portion of what they do will be unreimbursed moving forward. While I struggle with the notion that a local government should be backfilling what has traditionally been an expense provided by the feds, I don't think this is a safety net service in my opinion. And so I think we have a responsibility to ensure that organizations like this are able to keep their doors open.
Okay, I'll think about it some more because we're not voting yet. My first thought is that I don't support this. I think that they provide some services in Bristol. I mean, I've heard, not recently, but in the past, I've heard the police chief say that they do provide services in Bristol and are valuable. But I think of them mostly with their headquarters in Laconia and in Plymouth. And in Laconia, I think in addition to the mental health, they're doing a lot of things on substance abuse and homelessness, and I think that they have expanded their scope in ways that they're not just about mental health anymore. Go ahead, I'm probably gonna regret saying that.
No. I think what I would say is most of those issues that you mentioned go back to mental health issues.
Yes.
And that in the end, if we don't support the mental health help, we're gonna pay more with police and other issues, drug issues, self-medicating, all of those things. So I think that's almost an investment in the community.
I think it's probably worth noting too, as a community mental health center, the state of New Hampshire helped create this construct to put mental health in communities across the state where it just simply didn't exist. So, I say that in the context that you mentioned they've expanded services. They work, I won't say they're not a part of the state government, but they are contracted for a lot of the services they provide from the state. So the state signs contracts with them to provide respite housing. The state contracts with them to do, I forget what they call it, but it's essentially a critical kind of triage team to reach out to people who are experiencing, let's say, suicidal ideation and prevent them from going to the emergency room and racking up a big bill. So these are organizations that they don't have a private incentive to do something for profit purposes per se. It's about as non-profit as a non-profit can get. Maybe that's a good way to phrase it.
Okay. Anyone else? Not hearing any more comments, I think we can go ahead and have a vote on the motion to amend. So I'm going to call a vote on the motion to amend line 575 from the current amount of $7,000 to a new amount of $8,716. I don't think this is gonna be unanimous, so if I could see hands so I can count, I'd appreciate that. All in favor? Aye.
Aye.
All opposed? The motion passes 6-1. Any other changes that anyone wants to propose? All right, not hearing any other proposals, I think we can go ahead and vote now on the bottom line here. So I'm gonna call a vote for approving section 4652 in the new revised amount of $40,814. Did I get the math right, Christina? No, you're not doing it.
Yep.
Okay.
You did. No, I was waiting for the document to
It's
open.
40,000 up.
So it went from 39,098 to 48,14.
Yeah.
So we're voting on section 4652, which is outside agencies in the new revised amount of $40,000, $40,814. All in favor? Aye. Opposed? Abstained? Les, were you a yes?
I was, yes, sorry.
That's okay. I don't have my glasses on. I don't know if I missed
I
it.
couldn't do it.
That passes 7-0. Wow, we are flying. Let me get back to the agenda. So we've done the 3 sections we're planning to do today. The next item is the minutes from our last meeting on October 28th. Let's see, I'll start with the motion to approve the minutes of the October 28th meeting.
I'll second it.
So motion by Paul, seconded by Brian, and now we will correct and amend them before we approve them. Can I start with our normal
I
proofreader?
just have 2 typos.
Oh, excellent.
At the bottom of the first page, last paragraph says motion to approve the minute, should be minutes.
Sorry.
I didn't catch that at all.
Can you go again because my mouse wouldn't.
It's on the first page, under review and approval of minutes.
Got it.
The second paragraph says motion to approve the minute.
Yeah.
Okay, gotcha.
And then at the top of page 2, in the second line, it should be the Lakes Region Visiting Nurse Association. It says and Lakes Region, it's
See,
just grammar.
okay.
If
Just
you
those
don't
2
put the
things?
D in, it sounds like it's all one agency
Okay.
grammatically.
Did anyone else have any corrections or desires for changes? Not hearing any? We'll go ahead and vote to approve the minutes as amended. All in favor? Opposed? Abstained?
Abstain.
So 6-0-1, the minutes are approved. Let me get back here. So, correspondence. We talked about the correspondence from, at the last meeting, which has been distributed to all of the members. I don't think that I have any additional correspondence since our last meeting. Does anyone have any correspondence they want to share with the rest of the committee? Christina, do you have anything to share?
No.
Okay.
The schedule that we sent out to you is just cosmetic changes. There's no date changes in it. We just want to make sure you have the most current one. So, other than that, no.
No? Okay.
Can I just ask a quick
Yes, go
question? I meant to ask this a second ago, but if the committee would consider removing nonprofits from the appropriation list that would be discussed, you said, at a further, later date, do we know when we're talking about
Are
that?
you looking at the minutes?
Yeah, the minutes from last week, staff comments.
Oh, yeah, okay. So we can,
I didn't know if that's something we're supposed to do today
Yeah.
or another time.
good catch.
Okay.
I think that that is something we do want to do tonight.
Mhm.
So, it's not really under new business. We'll do it, I guess we'll do it under comments. Excuse me. Usually we start with the select board. Scott, anything going on at the select board that you want to share that we need to know about?
No.
Okay.
The only, no, just that you've seen the project moving along. Paving will be done on the 24th.
Yeah.
Trees are going in this week.
They're in.
Yeah.
They are, all
Yeah,
right, so they
this
went in this week.
Late breaking.
I've been on
Late
vacation.
breaking.
So the trees are in,
Okay.
and we had a water main break.
But yes, the last Friday.
Jeff and his crew,
It's actually the third in a month.
yeah, it
This is a
seems like
month.
difficult.
Jeff and Highway, when I drove by at 6:30, I felt so guilty. I turned around, went back. And then I'm like, I'll feed you. What do you want? They're like, we're done. I'm like, great, I'm going home.
Have they all been in the same vicinity or scattered?
Scattered, different locations,
Lake Street, Summer Street,
Beach Street.
and Beach, yeah.
Yeah,
Yeah, well, it go over,
yeah. Well, Summer Street wasn't our fault.
Oh, we did meet with Jeff. We did tour the facility down at Water and Sewer. And, you know, they're keeping up, maintaining the system as best they can. They try to do a lot of stuff in-house, they take pride in that. So we have some skilled employees
Yeah.
down there doing that, so.
And they still have
the
one
gym
open
addition.
position.
The what?
I was gonna ask that.
The equipment addition they were talking about.
I don't remember that.
Jeff was talking about applying for some grant monies, but basically adding a grate/filter at the beginning of the system to catch all of the paper and flushable wipes and all the stuff that gets ground up. And the grounding isn't working as well as it should. Pumps are very old. So the state is recommending the system that goes in front of that. It's actually, as things go down there, pretty cheap at, I think we're starting around 150,000.
It's I actually watched it, the demonstration for it down there. It's pretty neat.
Yeah.
And there are two different ones, but one will go way down in, and it's only like that wide.
Yeah. So I would anticipate seeing that in the next year or so in his capital budget.
Okay.
They did also get awarded a grant for asset management on the wastewater side. So right now, it hasn't been determined, they have been awarded a grant for $30,000, and they can do a loan with New Hampshire Department of Environmental Services for $30,000, which will complete the whole project. It hasn't been determined if they're going to move forward with the loan yet.
Same project has been completed on the water
On
side.
the water side.
Okay. I do remember hearing that they had done.
Also, he mentioned they're looking at putting a couple of vehicles up for sale, for auxiliary
Yes.
vehicles. They have a new vehicle they need to get lettered. Their vehicles come from purchase through their
Enterprise
Capital
reserves.
reserves.
Yeah.
Yeah, not in the budget.
Right.
Okay. That's it for the select board, right?
I believe so.
Okay, we can come back if you think of something else.
Okay.
I want to go back to what Sue brought up, which is, I had brought up earlier that, I think it's Britt House and Katie and Day Away, and I think even First Family or whatever they're called.
Health first.
Thank you. They had asked for money last year, but they didn't for this year, so my feeling is that they're not precluded from asking in the future, but if they've gone 2 years with not responding, let's take them off the invitation list, save ourselves a little bit of an administrative load that, I mean, the staff handles it, not us, but we don't need to send those notes out to people who haven't for 2 years. So, I think, but I didn't want to make that just as a arbitrary is not the right word, but I thought it was something that we as a committee need to review, and agree. So I'll make a motion to approve a policy that after 2 years of not responding to requests to submit a funding request, that we drop them off the invitation letters and
Second.
continue, go ahead with that. Okay, so motion by Paul, seconded by Joe. Did I say it clearly enough that we can vote on it? Felt I stumbled a little bit there. Any other comments, questions? So we'll go ahead and vote. All in favor? Aye. That's 7 yeses, so against noes and abstentions are zeros.
We'll add that to the bottom of our tracker,
Perfect.
so.
And then we'll go around the room. Any comments that you, Sue, any comments that you want to share? Brian, anything? Les, anything you want to share?
I'm good.
I apologize for not being here the past few meetings.
We're glad you.
Well, hopefully everyone is healthy and you're doing good now.
Much better.
All right. I think that's it. So before we take a motion to adjourn, I'll just say our next meeting is actually next week. And so next Tuesday, the 25th, here at 6 o'clock, and we'll do, well, the list is there, but it's a lot of the planning, zoning, assessing is the majority of that and the list.
Yes, you're up.
Kelly Garden, TTCC.
Patriotic, yeah. I forgot to tell you, sorry.
The other thing I'll just mention before I forget, going back maybe to comments, is I haven't gone to all of them, but I've gone to the majority of the all committee meetings. And one of the things that I think has been a pretty standard comment there is that we have it would be nice to do better at communicating, at sharing, to let people know what's going on, that we're all pointed in the right direction and rowing in the same direction. So I reached out to Christine and I said, I know that we don't need the whole planning board to show up and we're gonna consider the planning meeting. But I said, I think that just my feeling was in the idea of over-communicating, that I asked Christina to work with Joanne to reach out to all the boards and committees, because obviously all the department heads are already gonna be here, but all the boards and committees to tell them, hey, you might be interested in this part of the budget, and the budget committee's gonna handle it on this day. If you wanna come to the meeting, feel free to. They're always free to come to the meeting. It's a public meeting and they're members of the community, but I just thought it was a way to kind of, one of the things I challenge myself to is when I say, okay, I'd like other people to communicate more, and then try to turn it around and say, okay, what can I do? That's what I came up with. So, I don't know we're gonna get a lot of people to show up, but we're gonna make sure that everyone knows. Go ahead.
I was just gonna, we are going to do that, but we also, so I wanted to make sure that everybody knows that we do go, so Joanne will go with, and meet with the planning board and go over their budget, and they vote on their budget at their planning board meetings. But I understand having them here to have, if there's something that comes up and they need to answer a question, it's nice to have them here, so.
I want to make clear, I'm not saying that we're demanding that they come, it's not, but
Right.
it's an invitation.
But we don't create their, I just want to make sure we don't create their budgets. They vote on them, they
But they could say, hey, the budget committee's gonna discuss our budget, they could change it. I kind of would like to be in the room when they're talking about it. I don't know that we get a lot of people to say that, but we might get 1 or 2 people that'll say that and come to the meeting.
It's true, you did change Conservation Commission on them once.
Yeah, who picked that? And then all of a sudden I'm doing that every year.
All right, I think I've gone long, I think that's it. Anything else? Someone want to make a motion to adjourn?
I'll make a motion too.
Motion by Sue, seconded
Thank
by
Second.
Les.
No,
Motion.
Joe, it isn't it?
Seconded, Joe, okay, motion by Sue, seconded by Joe to adjourn, all in favor?
Aye.
Motion is adjourned, see you next
That
week.
was my first attempt, so.